What's going on, everyone? Happy Tuesday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far, and of course testing negative for all those viruses. It is time now for the Tuesday edition of the Virus Update for Tuesday, September 23rd, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. I give you the latest news, data, wastewater, post for Mets, really anything I can find to keep you healthy, safe, and informed of what's going on. Want to stay informed? Just subscribe to my channel down below. If you like today's video, give it a thumbs up. Hit that notification bell to be notified of my latest videos and help grow the channel by sharing this video with anyone you know. Of course, the more the channel grows, the more people I can keep informed of what's going on. Already, we do have a few news stories to take a look at today. The last piece of news, we'll probably be on that for a few minutes. It's something that's very troubling, bothering. I think it bothers a lot of people. We need to talk about it. Yeah, we have to have one of those good old-fashioned discussions. Haven't done one of them in a while. Then we'll take a look at some of the daily data. New York State is not in yet. Maybe it'll be in when we get to that portion of my tabs here in the browser. So fingers crossed that maybe that'll be in then. And we'll take a look at a few wastewater sites. All right, first off, the PMC COVID dashboard update through September 22nd, 2025. The CDC reports 29 states and DC are experiencing high or very high transmission levels. The heat map is a patchwork quilt with COVID levels staying considerably varying considerably from state by state. Transmission is shifting north and east. Transmission's coming down in the south. Transmission starting to come down the west, though. You still see very high levels in those areas in some of the states. PMC estimates 850,000 new daily infections as post-peak transmission shifts north and east. PMC COVID dashboard COVID levels by state, Alabama to Mississippi. Note that even levels that the CDC calls low, like Guam at 1.5% actively infectious, are at the threshold where I would tell people who have lapsed, it's time to mask up. Yeah, this is coming from Mike Horger. He's right. We know the CDC has changed again and again what's considered what. Like, what used to be very high may only be high. What used to be high is moderate. Moderate now is low. They keep changing it to look better than it really is. And you can see here in some of these states, Alabama, still 1 in 24 actively infectious. Kentucky, still 1 in 30 actively infectious. But you do have some states that are not doing bad. At least according to Wastewater, Michigan would be very low. 1 in 138. So that would be some good news. Mississippi, we don't talk enough about Mississippi. There's some states that we don't get much data or news from. Mississippi is one of them. 1 in 63 actively infectious. That puts it in low. And right now, New York State. Well, let's read here. PMC dashboard COVID levels by state, Missouri to Wyoming. New York State is a good example of where the CDC label of moderate simply does not cut it. 1 in 49 is very high, and data quality statewide has been poor. I've been on this. There is a ton of wastewater sites in New York State that are not updating, and that is a real problem. That really needs to be fixed. They really need to do something about that. Pennsylvania is still coming in at moderate, but I got to be honest with you, my state's not far off from going to high. I know it's not good whatsoever. We can see the forecast here. It does look like things will continue to drop a little bit for the time being. Eventually, we will see a rise again, but not seeing that show up here in the forecast yet. In fact, as we enter October, the start of October, his forecast is showing a continued drop. So that is really good news. It looks like we will stay, though, north of 500,000 infections every day. And once again, right now, just to repeat, we are currently at 850,000 new daily infections. So we have gone below 1 million, or the peak, which was believed to be 1.2 or 1.3 million. Yeah, that's pretty high. All right, let's go to another country for a moment. New Zealand COVID weekly update, September 15th to the 21st of 2025. New cases, 248. Reinfections, 150. They did have 6 COVID deaths, 200% increase there. Total deaths, 4,795, that's up by 6. In the hospital, 34, and 60.4% were reinfections. Now, we have some deaths there that we don't know. Were they COVID or not COVID? And that's why you see, sadly, 17 deaths were reported today, but 6 they know were COVID. 2 not COVID. 9, well, the status of that is not available. 1 in their 30s, 2 in their 60s, 3 in their 70s, 6 were in their 80s, and 5 were aged over 90. Of these people, 11 were women and 6 were men. All right, more from Dennis the COVID Info Guide now. Staying in that region of the world, Queensland Weekly Respiratory Surveillance Report, September 16th through the 22nd of 2025. Mostly good news here, just a little hint of bad news. First off, reported cases, COVID, 487, or down by 27.3%. Influenza, 2,706 cases, down by 22.6%. RSV, 718 cases, down by 15.3%. Hospitalizations, COVID, 43, down by 20.3%. Influenza, 155, down by 25.1%. RSV, 56, or up. Yeah, in this case, up by 16.6%. All right, taking a look at variants here, the KP.3.1.1 variant is 47% of the cases, NB.1.8.1, 39%, XFG is 8% of the cases at this time. Moving on now to this. COVID alarm in Albania. Doctors, emergency rooms are being overcrowded. Yep, Albania is seeing an increase in things when it comes to COVID, and they are seeing that there is an increase in the number of people using the emergency rooms, and this is really starting to overwhelm them. And the most common symptoms, they say, of COVID: persistent and dry cough, fatigue, fever. Some people may also notice panting, chest tightness, headaches and body aches, nauseous, or loss of appetite. Moving on now to this. Measles outbreak growing in parts of Arizona here in the United States and Utah, health officials say. Yeah, this is not good. One of the largest measles outbreaks in the United States is now centered in bordering areas of southwestern Utah and Arizona. Remember earlier we were talking about there was that outbreak in Texas? Well, now other places are dealing with an outbreak. Texas somehow got their outbreak under control. In southwest Utah, all but one of the 23 confirmed cases are among unvaccinated school-age kids. The Southwest Utah Public Health Department reported in Mojave County, Arizona, which health officials believe is connected to the Utah outbreak, there have been 42 confirmed cases of the highly contagious virus. So, yeah, this is not good whatsoever that this is happening. About 79% of kindergartners in Washington County, Utah, are vaccinated against measles. Just 79%. Think about that. 21% are not. So they clearly got a problem here. They need to get this under control. Outbreaks continue to pop up here of measles in the United States. All right, going back to the UK for just a second. Going back internationally, I should say. Norovirus. This is from the UK Health Security Agency. And they're saying norovirus is incredibly infectious, so if you're feeling unwell, stay home for 48 hours after symptoms stop, as you are still infectious during this time. Alrighty, moving on now to this. This is rather interesting, alarming, concerning, whatever you want to say about it. This is not good whatsoever. Hospitals get dinged for reporting too many infections. Wait, what? Hospitals get dinged, meaning in trouble, because they report too many infections? Allow me to explain. In some cases, the solution is not to test. So in other words, don't test for the viruses whatsoever. Yeah, this is I can't even believe I just read that. But yes, I have to read that to you. And here's what they say. When a hospitalized patient shows signs of a dangerous, potentially deadly infection, you would expect clinicians to move quickly, testing to figure out what's wrong, then treating with the right medicines. But that's not always what happens, and the reason is often financial. Federal regulators can fine hospitals hundreds of thousands or even millions of dollars if too many of their patients get hospital-acquired infections. This is really ridiculous. So, basically, we often you hear me say, you'll hear other people say, you'll see it on X saying, they're not testing in the hospital to see if it's COVID. They're not testing to see if it's measles, this or that. Well, yeah, there's part of a reason for that. They can get in trouble if they're finding too many cases. That's absolutely ridiculous. Also, hospital-acquired infections are a real problem. Many people go to the hospital, and this has been happening long before COVID. Many people go to the hospital for one thing and end up picking up something else along the way. Well, this is something that has gotten much worse. Say you go to the hospital with a broken arm or something else, and you don't have a virus at the moment, but maybe the hospital has some COVID patients there, and COVID starts to spread throughout the hospital. You pick up COVID. Well, or you start to feel sick, with what could be COVID. They may not test to see if you have COVID because, well, we're starting to come into a COVID outbreak. We can't allow there to be too many infections because they could get fined. It's ridiculous. We should not be trying to suppress these infections. They shouldn't be happening in the first place, and when they do happen, they should be testing so they know what the patient has so the patient can get the right treatment, okay? And someone's probably getting ready to say, oh, look at this fear-mongering crazy person. I'm not fear-mongering. This is reality. When you go to a hospital, you want to get better. You go there to get better. You don't go there to get more sick. You also want answers. So if you're in a hospital, say a loved one, say your mother or grandmother is in the hospital for something. Maybe they had a fall. And they have to stay there for a few days. Well, if something starts to change and you notice they're not normal, maybe you notice they're starting to get sick, you want answers. You want to know what's going on. Hey, can you do a test to see if they have COVID, flu, or something else? In many cases, they may not do that, according to this, because they may get dinged or in trouble for doing that. That is totally ridiculous and should not be a thing. All right, we could do a whole video on this topic. We could read more of this story. We're not going to. I think you're fed up at this point. I know I'm fed up with this. It is just totally ridiculous that we don't do more. I mean, masking, clean air. It should just be a thing in hospitals to help keep patients safe. Then we wouldn't even have to worry about hospitals getting in trouble for too many people getting hospital-acquired infection, because we would be preventing it. Hey, my website, datareport.info. We've got a whole bunch of tracking threads. There have been a ton of people checking out the tracking threads as of lately. That's fantastic. People are trying to inform themselves of what's going on. Let's take a look at what's going on in Canada now, shall we? COVID viral activity level is still moderate. Flu A is low. Flu B is low. And RSV is also listed at low at this time. All right, let's take a look at birds and migration, shall we? And we do see here that over the last 24 hours, birds continue to migrate south for the winter. Let's see how many migrated last night. And it does, once again, go into the hundreds of millions. In fact, it goes over 300 million. No, make that 400 million birds migrating south. Big push in the northern plains. So, yes, birds are migrating to the south for winter. Why do we care about that here on a virus update? Well, migrating birds could potentially spread bird flu, and of course, bird flu has been very problematic. Alrighty, moving on now, taking a look at air qualities. While we do that, let's pause and take a hydration break, shall we? Alrighty, water was the drink of choice today, and oh my, take a look at that. Washington, Oregon, yeah, we're starting to see those reds, even some maroon and purple pop up. Yes, that does also include portions of Idaho where there are some oranges popping up. Those are bad air qualities. That's not good for your health. Some yellows, even a few oranges mixed in the Great Lakes, the Mid-Atlantic, and portions of the Northeast. So that's not good. And Southern California also dealing with some bad air qualities today. Of course, the Pacific Northwest problem does stem from wildfires. Hopefully, they will be getting some rain there soon. Taking a look at what's going on in Florida, Pinellas County, Florida to be exact, and yikes, look at all these various different calls. That's not good, and we're seeing a lot of red here, which means ambulances are stuck at hospitals waiting to discharge their patients. Philadelphia yesterday, 743 EMS incidents. Doing a live look in at Montgomery County right now. Let's refresh this. 11 EMS incidents. That's about normal for this time of day. Taking a look at what's going on in Chester County, if we can, and we do see, several calls there right now. Close to normal, but no, actually, you know what? A little bit busier than normal. We're seeing heart problems show 1, 2, 3, 4 times. Sick person showing up. Respiratory difficulty. So yes, it is actually rather busy there at the moment. Of course, Pennsylvania wastewater for COVID is still rising at this time. It dropped last week, and then over the weekend, an update came in, which we got yesterday. It showed, nope, the level went up a little bit. It's 4.67. If it goes above 5.3 in this wave, that would be high. Right now, it's listed at moderate levels. And variants in wastewater in Pennsylvania, take a look at this. They are saying 100% of the variant is now XFG. Okay. Moving on now to hospitals in Pennsylvania, we do see here, I have to refresh this because I do see it is updating. We do see there is one hospital in western Pennsylvania today that is dealing with a problem. 4-hour divert at AHN Forbes Hospital. Look at that. Emergency department overcrowding. That's not good. And we also see few hospitals in southeast PA and some in the Lehigh Valley dealing with problems today as well. How about New Jersey? In New Jersey, we see RWJBH University Hospital Hamilton, full and total divert for patient volume. Full and total divert at Inspiro Center Mannington. Looks like they have a CAT scanner issue. Also, Cooper University Hospital is doing a full and total divert for patient volume at this time. That's not good. Alrighty, drum roll please. Do we have anything from New York State yet? No, New York State is not in yet. I would hold off to record this video longer. I would wait a little while longer to record today's video until New York State came in, but we have an appointment at 3 o'clock. I'll be masked at the appointment. It's actually not a doctor's appointment. I gotta have some new tires put on my car. It's time. I've put it off long enough. Gotta get it done, and it's today at 3 o'clock, so I can't sit around and wait for New York State to come in. Did their hospitalizations come in? I don't think they did. No. Alright, let's end today with 2 wastewater sites. And take a look at this one. Chester, Pennsylvania. COVID there. 220,000 population. This is the city of Chester in Delaware County. It says 220,000 population. The city of Chester is not that populated, but the county of Delaware County, which is actually even more populated than 220,000, this covers a good portion of the county. And we can see here, COVID and wastewater is rising at this time. We also see low levels of norovirus, but it is starting to creep upward at this time. Let's go somewhere else. How about we go somewhere on the West Coast, shall we? Let's go to Snohomish, Washington, and see what's going on there. And we do see COVID is listed high, but at this time, it is dropping ever so slightly, so that is some good news. RSV is listed at low, Influenza A is low, Influenza B is low. Yeah, really, everything else is fine there at this time. Alrighty, folks, that does it for today's virus update. If you enjoyed today's update, give it a thumbs up. Of course, subscribe down below, hit that notification bell, leave your comments down below. I got a feeling, let's go back for a second, I got a feeling hospitals getting dinged for reporting too many infections. In some cases, the solution is not to test. Yeah, this little discussion we had here, I got a feeling that's going to leave some comments. Because you know what, that really, it gets to me that hospitals actually get in trouble for that. I mean, I get it. They should be in trouble for infections, but they should also be allowed to report what's going on. They should have to test. They should be mandated to test. If something changes while someone's in the hospital, they should be testing. And you know what? There's even cases where someone shows up to the hospital with what could be COVID, flu, or something else, and they don't even bother to test for that. It is totally ridiculous. I've heard the stories of it happening. Maybe it's getting better now. Maybe they're not doing that as well. I don't know. But the point is, something needs to be done. I mean, you should be outraged about this. I am. Alrighty, folks. I'll see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Tuesday afternoon. And thanks for watching.